Hi guys, hope you are all good and safe. In this video, I'm gonna talk about probably the most important and critical period after the hair transplant, which is the post-operation care and the first 10 days after the surgery. I'm going to share my experience and cover the things you need to do and avoid in order to achieve the best possible results. Because the incorrect care can lead to decreased graft regrowth rates, bad regeneration of a donor area, or even infection. Okay, without any further ado, let's jump straight into my surgery day. This is my picture right before the procedure. Here my hair on the donor area was already cut to approximately 2 mm. Then the area to be operated was washed with antiseptic and I got the local anesthesia in form of multiple tiny needles in my head. And for the next hours of the surgery, I was watching YouTube while one doctor and few assistants were bringing my hairline back to life. Just to inform the new viewers, I had a FUE transplant of 4,800 grafts. Surgery time was approximately 8 hours and I did it in Istanbul, Turkey. This is what I got right after the surgery. Yes, I know, it looks a bit scary, but at this point in time, I didn't feel anything as the anesthesia was still on. On the same day, before going to sleep, I took few painkillers pills as the anesthesia effects last about 10 hours, and after that you'll inevitably feel the pain and discomfort in your body. The first important thing to mention here is that for the first night, it's mandatory to sleep in the upright position in order to avoid any physical contact on the transplanted hair with any surfaces. Using a normal pillow might be a bit challenging. Believe me, I didn't have one and I barely slept the first night. I would recommend to use a travel pillow as this will make your life easier and you'll definitely sleep better. During the night, all the liquids which were injected under the skin during the procedure went out, and in the morning my pillow looked like this. Hopefully, the clinic provided the disposable diaper pads and pillowcases in the hotel were changed daily. In the morning, the first thing I got my back head bandage changed. In general, the bandage should not stay on longer than 24 hours after the day of the hair transplant. A small amount of bleeding is expected. If you notice any bleeding, fold a clean bath cloth and apply firm, constant pressure to the area for 20 minutes. Remember that hot beverages and activity may increase bleeding. If excessive bleeding persists, call your doctor for further assistance. Another important day after the hair transplant is the second day, as this is the day when you need to wash your head. For this, I was given a special foam called Panthenol, with which my donor and transplanted area was covered. After a few minutes, doctor started to wash my head with cold water, tapping gently on the head with his hands and using low pressure water to rinse the foam off. Immediately after, I use a soft towel to dry the head by gently putting it on the head, not rubbing it as I dislodge the transplanted grafts. In general, most patients develop swelling within 2 to 4 days after the surgery. This condition can last up to a week and may even cause swelling of the eyelids, which can lead to eye being closed. As you can see in my case, the swelling started on day number 2 and my head looked like a deformed potato. On day number 3, you might notice tiny little crusts in the transplanted site, which will turn pinkish. In my case, most of the pain and discomfort was gone by this time. On this day, theoretically, all the transplanted grafts will have adapted to the scalp and they cannot be easily dislodged. On day number 5, the scabs are still there, and I had mild itching, which is probably a sign of healing. The incisions in a donor area will have healed by this time. Starting with day number 6 is allowed to resume most of your normal activities, but in general it's recommended to avoid heavy activities like running, cycling, swimming, or any other activity which will increase your heartbeat. If you are uncomfortable to appear in public with a shaved and a crusty head, like I have here, you can wear a loose-fitting hat, but make sure to check with your doctor before doing so. In the second week after the hair transplant, the scabbing and crusting starting to feel off and disappear, and the scalp becomes pink. From week 2 until week 8, the transplanted follicles enter a resting phase, or so-called telogen phase, and the hair starts to fall off due to the shock. This is completely normal, and it doesn't mean that the procedure has failed. It is possible that a few of the grafts have been dislodged, but most of what you are seeing here is a crust of fatty tissue surrounding the graft and a little shaft of hair, meaning that the follicles are safe and normal growth can be expected. Finally, day number 10. Here, all my scabs are gone, and I am slowly moving to a next phase, called ugly duckling. In the upcoming weeks, my hair will start to fall off due to the trauma of a hair transplant. As I mentioned at the beginning of this video, in order to achieve the best possible results, it's essential to know what to do after the hair transplant procedure. Here I will try to highlight a few important tips to follow from the moment the operation is done until a couple of weeks later in your quest to redeem your crowning glory. Let's begin with what is allowed to do. For the first day, it's mandatory to sleep with your head elevated. This position is important to avoid any excess swelling on your scalp. Try sleeping on a reclining chair if you can, to keep your head elevated. If the grafts were implanted in the lower crown, or if there is a strip scar, you should sleep on the side on the first 2 nights, so as not to disrupt hair growth or cause the grafts to fall off. Do use an ice pack to reduce any bleeding or swelling on the first week. However, place it only on your forehead or on the back part of your head. Also, you need to hydrate well before and after hair transplant. Do take painkillers if you experience pain and discomfort, especially after 3 or 4 hours post-surgery. As I mentioned a few minutes ago, do expect some hair to fall out from the transplanting areas about 2 to 4 weeks after a procedure. This is entirely normal and part of the natural hair growth cycle. This doesn't mean that the follicles are damaged. Your hair will start to regrow within about 3 months. Now, let's switch to things you need to avoid. First of all, don't sleep flat on your tummy. Don't regularly bend over or lean forward or blow your nose violently on the first week. If you experience any swelling, especially on days 3 and 4 after the surgery, don't be alarmed, as this is completely normal. As I said, ice is allowed to be used, but not on the transplanted area. Don't do any heavy activity and sexual intercourse for 10 to 14 days. I know, it might be hard for some of young folks out there, but it's not impossible. It would be also wise to reschedule that steam bath or sauna appointment until the next month or so for the same reason. Another very important point is not to smoke for an entire month after the surgery, as doing so can interrupt blood flow to your hair follicles. Blood flow is crucial for the growth of the new hair. To prevent yourself from going cold turkey and losing money, I would suggest to start reducing your cigarette daily count a few months before scheduled hair transplant. Don't drink alcohol for the first few days after the procedure, as it might interfere with the blood supply to your head. Don't touch the newly grafted scalp. A little itching is normal side effect, so rubbing the sore scalp may result to the new grafts falling out before they can have a chance to grow. And finally, don't expose yourself to direct sunlight immediately after or even a few days after the procedure, especially if the scalp is still swollen. If going outdoors in daytime is unavoidable, wear a hat. In general, it's recommended if possible to have your hair transplant done during the winter, as this is the best period of the year for a hair transplant. That's all from my side. Hope that what is shared here would be useful for the people who are interested in having a hair transplant. If you have any questions, feel free to ask them in the comment section. And if this video was helpful and answered some of your questions, hitting the like button would be much appreciated. Thank you. See you on the next one.